Together we achieve victory over heart failure.
Myself, Dr. Sushant Kumar Pathak from Patna. Today we are delivering into silent epidemics that India is combating heart failure. In India, the majority of the patients grappling with heart failure are surprisingly young individuals. However, in Western countries, the heart failure mainly affects the disease of elderly. Let's break down 5 essential insights on heart failure. First, what does it mean when a doctor tells you that you have heart failure? When a patient gets a diagnosis of heart failure, they think that it is the end of their life. The term heart failure can seem frightening, but it is simply means that your heart is struggling to pump the blood as efficiently as it should. The ejection fraction tells you how your heart pumps bloods. A normal ejection fraction is around 50 to 70% for an individual. With heart failure, it's majority of the patient it comes down to less than 30 or 35%. Second point, why are so many Indians affected by the heart failure? Genetics play a significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, the hypertension, diabetes, obesity, smoking are worsening these epidemics. It is a well-known fact that India is one of the diabetes and obesity capital of the world. Let's move on to third point. What are the signs and symptoms of the heart failure which a patient should be aware of? Of course, most important finding is easy fatigability. Patient get fatigue quite easily with doing light works, palpitation, nausea, shortness of breath, weakness, loss of appetite or vomiting. These are one of the most common symptoms of heart failure. How can you protect ourselves from this disease? Our heart works incredibly hard to keep us alive. These are the 5 golden rules I am going to discuss, which we can follow to return the favor to the heart. First is quitting alcohol, tobacco, and smoking. Secondly, practicing stress management technique, because in today's world, this smoking as well as stress is one of the most common cause of the heart disease. Third, incorporating daily exercise into your routine work. You have to have an physical activity, either in yoga or doing gym, etc. You can manage these things. Fourth point is dietary adjustment to maintain health. We should avoid fried foods, which are frequently available in markets, packed foods. We should keep our diet very as simple, avoiding high salt diet, etc. We should include more fruits in our diets that keep our heart healthy. Fourth is the looking for the signs and symptoms of heart failure and getting detected as early as possible. So if you are having any symptoms like easy fatigability, weakness, shortness of breath, palpitation, you should go to a nearest cardiologist as early as possible and discuss these things, so that if any signs of heart failure is developing, it should be detected and treated as early as possible. Lastly, what comes next after heart failure? If a patient gets diagnosed heart failure, surprisingly thankful to our medical sciences that lots of intervention, medical and surgical interventions and come out to improve the quality of the life as well as expectancy of the life. For example, simple medications and lifestyle adjustment can improve the both expectancy as well as the quality of life. If patient not responding to the medication, lifestyle modification, we have surgical options like implantation of CRT devices, biventricular pacing, AICD, or if a patient has any kind of valve damage, they can go for heart valve repair or replacement. And last, if anything is not responding, the patient may go for the heart transplantation. It is quite frequently done in moreover all of major metro cities or tier 1 cities. So diagnosis and treatment is quite important for the patient of the heart failure. So last point I want to add that prevention is always better than treatment. So we have to modify our lifestyle, modify our dietary habit, include yoga or exercises in our lifestyle, so that the chance of development of the heart failure or any kind of heart disease get minimized. Thank you.